Welcome to Secular Soup. Stay tuned for real talk about atheism, feminism, politics, parenting, and whatever the fuck else Amy and Amy want to talk about, because this is their show. And get ready for a whole lot of motherfucking profanity.
You want to hear a secret?
I won't tell anybody. Go ahead. If I sit next to you, I'm going to get gonorrhea. It's going to jump into me. Just two ladies hanging out.
Is it okay for me to make fun of his neck waddle if I make fun of my own neck waddle?
I'm not sure.
That's a real ethical conundrum.
Would you know if you were born a lizard person, or can you be like adopted into the...
I think you know.
We're such professionals.
We really are.
Buckle up, bitches. It's time to have some soup.
I'm Amy with a Y, and I am Amy with an eyeless today. That sounds interesting, Amy with an eyeless. That could be a cool band name. I am a blueberry floating in a bowl of tomato soup, and I am joined by two men. I don't know why I let two men on the show at the same time. That's worse than even having one, but one's a Canadian, so that makes it better. I had recorded an episode with Jason, who is one of our listeners and one of my serial harassers on Facebook. And we talked about an experience that he had with healthcare in Canada, because Jason is from the United States, like I am, and his wife, I guess, had the audacity to get sick in Canada. So he got to experience the horrid, wretched Canadian healthcare system. And I've also got Cory Johnston on, who is a well-known podcaster and Canadian. So, Jason, why don't you introduce yourself quick? Just tell us who you are and why you're here, I guess.
Well, thank you. My name is Jason Paul Benell. I am from Central Iowa. I don't have a podcast of my own. I am vice president of Iowa Atheist Free Thinkers, so very big deal, as you know. And I just wanted to share my experience in Canada with you today.
Awesome. And Cory, tell us about you and your podcast.
Well, I guess I've got, I used to podcast mainly atheist and skeptic issues under the Brainstorm podcast. And since I have switched to The Mind of a Skeptical Leftist, which is my main solo show, I do co-host another show with three other people. It's called Skeptarchy. And then I do a Saskatchewan politics podcast as well. So
So you're a serial podcaster.
Yeah, I'm addicted.
Just can't get enough. Yeah. And your new podcast, Skeptarchy, features Dell, who is one of our best friends at the show here, who lives in Minnesota like I do, and she's fucking amazing. They're fucking amazing.
She's brilliant.
So,
they're brilliant.
Yeah, it's hard to remember pronouns sometimes.
Sometimes.
But Dell is amazing. I fucking love Dell. Any show that Dell's on is a good show. I loved Brainstorm. I miss it because I liked the roundtable format where you always had kind of a different group of... There were just a bunch of people weighing in on the same topic. I really liked that. So, anyway.
Yeah, we had a good balance of opinions and intellect.
Yeah,
so.
Yeah, I like that. Our show is mainly about my intellectual superiority and my opinions being better than everybody else's, but it's nice once in a while to hear someone go the extra mile and be like, your opinion counts too. It's heartwarming. It's ridiculous, but it's heartwarming. Yeah. So, the reason we're talking about Canadian healthcare is that American healthcare, you may not know this, Cory, our American healthcare system is literally the worst thing ever. It is a cesspool of hellish nonsense.
I've heard that before.
Zero sense to anybody, helps almost nobody, and is ridiculously expensive. And so
specifically designed to take your money and kill you.
Exactly. Yeah. I mean, healthcare is treated as a commodity, which it's weird to me because Americans have somehow gotten on board with the idea of public education and public police departments and public fire departments and public libraries. Like, we have all of these other kind of socialized systems here, but we can't wrap our brains around extending that to healthcare. So it's like, we understand that kids deserve an education and kids should just be able to go to school for free, right? That's just the thing. Like, we've all kind of agreed on that. And for the most part, obviously rich people send their kids to private schools. Yeah. That's always going to happen. But
I was going to say, have you all agreed on that, though?
Yeah, no, we haven't all agreed on it.
It's like kicking and screaming, and then they have to deal with paying their taxes for the local schools.
Yes. Yes. But for the most part, like, we've all grown up with the idea that school is a thing that's there, that just should be there, that our kids should go to.
Yeah.
Healthcare, we can't get over that mental idea that why would I pay for somebody else to go to the doctor? Like, that's ridiculous. I take care of my own family. I don't want these moochers not, and part of the reason is that we have really made healthcare, we've so ingrained in our people the idea that healthcare is a privilege that you earn by working hard enough. And because we have health insurance that's tied to our jobs, that really reinforces that if you're not working, then you don't deserve health care. You should be working, and then you'd get health care through your jobs. So fuck you if you don't have it.
Unless you're on Medicare, because by age, you just are entitled to that. But everybody else is a moocher.
Which, when Medicare happened in, 1965, people lost their goddamn minds about it, just like they're doing now with single payer. It was, we can't give people free health care? Are you fucking kidding me? But now, try to take Medicare away from somebody, and for all of its flaws,
hands off my Medicare.
Yeah. Oh yeah, the signs, get the government out of my Are you fucking kidding me? Like, God, I hate America so much.
They don't have to be consistent, just angry.
Just angry, yeah. Everybody's just got to be fucking angry. And there's really the mentality that, well, I have, for a while, I did have really good insurance through an employer. It was amazing. It paid for everything. So the people who have that are kind of like, my insurance is really good. If everybody else gets it, then mine might be bad.
Oh, I get so
angry. And
I
don't want to have bad health care just so other people can have it. Like, we're the most selfish people on the planet. And
yeah, I don't really understand how the conflation of good insurance with good health care.
Mm-hmm. Yeah, and that's the words are interchangeable.
It's all they know. It's all they know. I mean, really.
Yeah, it's all they don't know any other. They think healthcare equals insurance, and if you try to have a conversation with somebody about switching to a single payer, all you get is, well, who's going to pay for that then? I mean, who's going to pay for it? It's not free. How would you pay for that?
Indefinite VA care, that's there, but we can't afford to pay for that same health care for a Midwestern child. That's just beyond the pale.
Well, and I think they get around that because they can think, well, this person was in the military, and we worship nobody quite like we worship people in the military. So it's okay for them. But if you're 5 and you didn't join the Marines, then fuck you. You can have cancer.
I actually am a veteran, and it's interesting to go into the VA and hear people complain about health care while they're getting socialized health care next to me in the VA. Like, come on, man. Like, what is this?
Well, I feel like you hear that too as a kind of a backlash against ideas like single payer is, yeah, but the VA sucks, Sucks. Look at all these things they do. It's terrible.
Doesn't.
We don't want that.
It doesn't suck at all.
But it does, Jason. I heard it.
Your YouTube link defeats my experience.
Heard it from my uncle on
Didn't
Facebook.
you see that one link on YouTube?
Yes. I heard it's infested with rats, and
I died.
And they
That's
make
what
you
the
stand
media
in a
won't
bread
tell
line.
you.
It's just terrible. So yeah, what I'd like to do is have Jason tell he's got these 2 alternating stories of healthcare. One takes place in the land of the free and the home of the brave, where he gets the actual best care he possibly can for his child. And the other takes place in dirty socialism-ridden Canada.
Yeah.
So it's a great couple of stories to compare the 2 systems. So Jason, I will let you retell that since we lost the other entire fucking episode of it.
Well, we have Cory, so I'm not going to draw it out quite as much.
Yeah, make it shorter and better.
Basically, we were traveling from Iowa up to Winnipeg, where we were going to spend a lot of time and have a lot of fun and enjoy Canada Day up there, because we weren't going to be here for July 4th. We wanted to evade that celebration in the U.S. last year. So we went up to Winnipeg, and we had a pit stop in St. Paul, Minnesota. And outside of Minneapolis on our way north, I don't want to get into the details. It is kind of gross, but basically my daughter, who is 4 at the time, had her toe just mashed really badly. It was pretty bad, and it was partially my fault.
It was all your fault, but okay.
Well, true. But poor thing, we took her to the ER, and literally the first day of our vacation, we spent in the ER in Minnesota, where we had to get some drugs and get her taken care of at the ER. And like I was saying, the doctor was great, the staff was nice, but I got a bill at the end, and we actually had to talk to them about our insurance to make sure they could even treat her properly once we got in there. It was a little frustrating, but that happened. So we went on from Minneapolis, having this ER trip on our first day out to supposedly enjoy Winnipeg. Fast forward to Canada Day, July 1st. Right, Cory?
Yep.
My wife is going down the stairs out of the hotel, and I'm ushering my kids and my mother-in-law down the safe, secure, handicap-accessible ramp. My wife, the wild card as she is, decides to take the stairs, and we look over. She falls and just starts screaming. She fell down with all the bags on her and snapped her tibia in 3 places, an open break of the ankle in a foreign country on a national holiday in that country. It was pretty tough. No phone service for us. Had somebody, and actually a nice First Nations person was nearby, and they called the ambulance for us. And that was our start of this saga of the broken leg in Winnipeg on a national holiday in a foreign country.
And so you were saying that the care that your wife got in Canada was way worse than what you got in St. Paul, right? Because St. Paul, to be fair, Minnesota does have one of the better systems just because we're a better state. But
confirmed.
From what I understand, the way they treated your wife was just absolutely hellish, and she practically got gangrene on her leg because of the mismanagement of it, right?
Between fighting off the rats and the street urchins, we were able to get her to the ER in Canada. We had to have an armed escort because, as you know, private contractors were necessary.
That's right. Yeah.
The reality is, actually, the biggest holdup to her getting faster and effective care was the fact that we were Americans with private insurance. We had her in there. They stabilized her. The ambulance crew was excellent, actually. They got her right into the ER. It was excellent. But she actually had to sit in the ER, and it actually took an extra day because they went back and forth with our insurance company on whether they should treat her now, whether they should fly her back to Iowa, whether they should just do a temporary this and that and then get her out on the car as soon as possible. Like, they didn't know when the proper care and what they wanted to do was to obviously operate, put in pins and everything and get her stabilized. They couldn't do that until they could verify the private insurance would pay for it and authorize it. It was pretty frustrating. It was to the point where me and the ER doc and the nurses there were actually calling my insurance company together to make sure they would actually pay for what happened to my wife. Right. Meanwhile, I was watching Canadians come in with, obvious injuries. They'd show their ID, go get seen, and they were out of the ER in less than an hour, whereas we were sitting there not because her condition wasn't as bad, but because we had private insurance and we had to okay it with them first. I really can't say objectively I feel that we received worse care not because of the Canadian healthcare system, but because of the American healthcare system.
Yeah, and so this is what I'm interested from your point of view, Cory. Like, what's it like when you get sick, you get something that requires medical service? What does a standard visit look like for you in Canada?
I call the doctors, I make an appointment, I go in, and I come home, and that's...
and do they ask for your insurance card?
Well, if you have a doctor that you go to regularly, they have all that on file, right? They have you do have to have a Saskatchewan health card or a Manitoba health card, But basically, yeah, you hand them your card and you go home. There's no...
What's your copay?
That's a foreign language. I don't understand what that means.
I suppose you're all fancy and don't even have a deductible then.
Yeah, that's about right. Yeah, there's no deductibles.
You live like monsters up there. I just can't even...
Yeah,
How is he
I've
still
actually.
alive? How
Yeah.
can he live without paying all this extra money? I don't get it.
It's
You
bizarre.
must feel just kind of worthless. Like you're not doing anything to make the system happen. You're just freeloading off of Canada
Well-
and their doctors, right?
Yeah, the funny thing is, I pay taxes, and those taxes, part of that goes towards my health care.
Oh, so you pay like 90% in taxes, right? That's what I heard.
No, I pay slightly less than 30%.
I don't believe you. I think it's 90%.
So,
No.
I mean, obviously, if I make more money, I pay a little bit more because we have a progressive taxation system. But
Yeah, but that's when you hide your money in the Bahamas. You just-
yeah,
there's
well,
ways to get around that.
there are certainly people who do that.
So this is like Americans, so often we find ourselves really hemming and hawing over whether we should go to the doctor because of the expense. Like,
Yeah.
even if you have good insurance, you're going to have to pay a copay and you're going to have to meet a deductible. So I have friends who have insurance through their employers that they pay for as well. They'll pay $400 or $500 a month just for the
Right.
premiums.
Wow.
But they cannot go to the doctor because if they go to the doctor, they're going to have to pay the first $3,500 of that out of pocket. So they just don't go. Like I have friends that desperately need mental health care. Like they need to be treating their mental health issues and they can't. They just don't because they're like,
Yeah.
I can't afford that money. We
Yeah.
never ever call an ambulance. Like we do some if
Well-
it's a very, very serious thing, but
The thing with
nobody wants to ride
ambulances,
an ambulance.
like ambulances here are, I mean, it's partially covered, but there's also, depending on which province you live in, they have it set up like in Saskatchewan, you have to pay a certain fee for the ambulance as well, but it's usually not that bad. Like,
We did actually have to pay a separate fee for the ambulance. Not that
How
you
much
bring that
was
up.
it?
180 Canadian.
yeah, that sounds about right. I think it's usually 150 here.
I feel like it
I
should
think it's
be
'cause it was
more
Canada
like
Day.
$10,000 in America because
Yeah, in America it's thousands of dollars sometimes, depending on where it is, and hundreds on a best case.
And you're
scenario.
apologizing for calling an ambulance. Like, I'm so sorry. I made you come pick me up. I'm so sorry. Oh my
Well, in
God.
Canada, we apologize too, but
True. Minnesota is just Canada light. So, but even
Yeah.
like going to the ER, like people are constantly assessing, is this really that bad? Like, can
Yeah,
I
no.
live with a broken leg for a few days? I probably can. I'm sure it's fine. I'll just wait.
if you have to go to the ER, you like that's a thing we just do. Like if like my stepdaughter, she got stung by a mosquito or something, and so she had an allergic reaction, and her face swelled right up. And I mean, you just go take her down to the hospital, and they give her some, allergy Benadryl, allergy pills or whatever, allergy medication. And
Did they even ask you like why you didn't just try to treat it at home and not waste their time?
no, they did not.
Weird.
I mean, it's funny. You mentioned that, like, when my daughter had her toe messed up in Minnesota, they did ask, like, hey, are you sure you want us to give her these meds because it's more expensive? And and we actually have a decent insurance policy, but I could see a scenario where we didn't, and that's not a question that you should have to ask.
I have a friend who her daughter had actually had a bowel obstruction once, and as a person with Crohn's disease with lengthy experience in having bowel obstructions, they are about the most painful thing you can fucking imagine. It feels like there's an animal gnawing at you from the inside, and like your intestines are going to explode. And her daughter got one. They took her to the ER, and the doctor who was in the ER was like, I could give her something for pain, but that's going to cost a lot. And so, you might be better off just going home and giving her a lot of just some laxatives just to see if it passes through. And and she did, because she's like, I can't afford this. I can't afford an emergency room visit. So I'm picturing this child at home suffering with this horribly painful thing because her mom couldn't afford the thing that they're supposed to do, which is monitor you and give you pain meds and, x-ray it and make sure, you could die from that. You could need surgery from that. But nah, just take her home and try to keep her calm, and then you won't have to worry about it. And that's to me, just having been through that before, that specific thing before, and that kind of pain before, that is unconscionable to send somebody home to just deal with it.
It happens every day in a
It happens every day, especially in ERs. I've been told before,
that's crazy.
Just have you thought about going home and just dealing with it? Like, my son had surgery last week. He got a whole new robot spine installed.
Oh, wow.
Jealous.
I know, right? And we can only afford it because we're on the poor people's insurance, Medicaid.
Nice.
Which, still not entirely sure if they're going to pay for the whole thing. We're just kind of hoping and praying at this point. But before we left the hospital, they gave us prescriptions for pain meds, and I had them filled at the hospital. And as we're getting discharged, I asked the nurse, I said, it's like time for when his next pain meds would be. Can we do that here? Like, can you give those to him before we get on the road? Because it was a 3-hour drive back home. She's like, I would just give him one out of the bottle that you just got filled, because then the hospital won't charge you for another dose here.
Wow.
If they charge you for it here, it's way more expensive. So just give him one of those.
Wow.
Which I did, but that meant that I was taking away from the supply he had at home.
Yeah.
And now he's going to run out early because that bitch didn't really give me a choice and was just like, you don't want to be charged for more meds at the hospital.
And that is something.
Every decision is made by money.
And that's something that I did realize coming out of Winnipeg with the Health Sciences Center, if you must know, for the astute Winnipegian. Winnipegan?
It's got science in the name.
But,
Manitoban.
Manitoban? Yeah, that's probably more accurate because there's no other real cities there, is it?
Yeah, no, it's the only one.
But they did give her, pain meds and everything. And when we left, they basically told us that if she was a Canadian citizen, they would recommend that she stay off the foot for 3 months. And they would say, you're going to be on the disability type thing, go home, we'll take you home, we'll make sure you get back to, you had to do the physical therapy, but we'll make sure it gets done. But we were Americans, so they're like, well, here's an extra little ketchup thing. You know those ketchup things you fill up at like McDonald's or Burger King they just filled one of those up with pain meds and said, this is all we can really give you, and technically we shouldn't be giving this to you. But they were giving us extra pain meds not because of the cost, but because we're leaving with opioids. And I felt that was very different though than it being a monetary issue, and it instead being a what's the right medical thing to do issue.
Yeah.
So I found that to be quite different. And in the same vein, we had to go and fill her prescription, and they did not take our insurance at the pharmacy in the hospital there. So I had to pay retail, and I'm like, all right, like, what's it going to be here? Got the little credit card. And they ring up a 10-day supply of hydrocodone. And I'm like, oh, man, here we go. That'll be $19.78, please. I'm an American. I don't get the Canadian prices. So I can't, you can't give me that cheap price. And they're like, no, that's
just the price.
Cost. What? I Googled it. I Googled it on my phone while I was waiting for them to fill their prescription. That same thing would have cost in the United States $97. $97 in America for the same dosage that they charge me retail. And I mean $97 with insurance. Wow.
My husband is on long-term opioid therapy. It's a long-ass story, but he's had 6 back surgeries. He actually needs it. He's been through all these nothing else worked, whatever. But we have to pay cash for it every month because the injury is covered under workers' comp because it was a work injury. So workers' comp is supposed to be paying for any visits or medications related to that injury. So when he goes to the doctor, they have to separate out what does workers' comp have to pay for and what does Medicaid have to pay for. And they have to do the same thing at the pharmacy. And at the pharmacy, they will not pay for those pain meds because they don't like the dosage, because they have a dosage cap that they think they should pay for, and beyond that, it's your responsibility. But Medicaid can't cover it because it's a workers' comp thing, and even if they did, it's above the Medicare cap too. So we have to pay cash for it, and it's $180 a month just for him to get pain meds. $180 a month every month just for that. And we recently, like within the last month or so, went back to our lawyer and we were like, can we get some fucking money for, like, it's been like 12 years and they just do not pay for these meds at all. And this really seems ridiculous. And so they actually went to the workers' comp company and worked out an agreement where they would give us $3,600 to compensate us. That's half of what they owe us for these meds, if we agreed not to sue them again for a year and a half. So that's the settlement we are getting right now. They're going to pay our lawyer's fees. So our lawyer is going to get $4,000. We are going to get $3,600. And in return, we have to leave them alone for a year and a half. It's the most asinine thing. I just can't even, and all of it because of the dosage, because they don't believe that the doctor knows what he's doing.
Right.
And, you know.
I'm having a lot of trouble wrapping my head around how the insurance company or the workers' comp organization gets to contradict what the doctor said.
Oh, they do.
Like, which one of them has a medical degree?
Yeah,
all the time.
It's always the insurance, and that's what kills me. Like when you talk to people about single payer healthcare, all you get is the government and my healthcare. Well, right now, a for-profit insurance company literally is making all your decisions. There are medications I should be on that I can't be on because the insurance company says, no, you don't need those.
They talk about death panels.
Everybody knows that.
The death panels they're talking about exist in private insurance companies, not in government boardrooms or whatever. It's the private insurance companies. I get very frustrated when I hear about stories like this that you're talking about, because people will be upset about the labyrinthian system that they have to deal with, and they get mad about the forms and the copays and this and that, and they nod their head as they see the decisions come down, not realizing that maybe the problem isn't any one entity making a bad decision. The problem is the entire system itself. Imagine if you didn't have to deal with this at all in the first place. And you wouldn't have to worry about copays. I recently had an argument about the term pre-existing condition. Like, we talk about covering pre-existing conditions in the United States. That why are we using a private insurance company's word and term for a pre-existing condition? We shouldn't be arguing to protect pre-existing conditions. We should be abolishing the idea of a pre-existing condition, and then you don't have to worry about it anymore. It's ridiculous.
Well, because bodies have conditions. Like there's no. This is something that I really had to fight back when I was first diagnosed with Crohn's when I was, in my 20s. The way it worked was I was on my parents' insurance when I first found out because I was a teenager. So the insurance through my dad's place of work was the one that had to pay for my first surgery, and they didn't want to, so there was lots of fighting that went on from there. But from there, I had to make sure I had a job consistently for years, because if I lost my insurance coverage for a period of time and tried to get coverage again later, they could just say, nope, you've got a pre-existing condition, we're not covering it. Yeah. But if you switched flawlessly from insurance, like if I ended insurance with this company this month and then I started the insurance with the new company next month, then they would cover it. And so there were several years where like I could not be unemployed and I had to make sure that I got coverage the next month or I would lose that pre-existing coverage. And so part of what Obamacare did was got rid of that idea that you can't, an insurance company can't just say, well, sorry you have Crohn's disease, but fuck you, we're not covering anything. If you got a cold, maybe we'll help you, but all of that intestinal stuff, that's not our problem, which was a huge fucking thing. Like, people bitch about Obamacare, and it certainly is not great by any means, but that alone was huge, and people don't seem to understand how huge that fucking was.
Well, for like Cory, for your point of view, what she's describing, like this happens, you listen to that and you think, oh, clearly it's kind of the same thing, and it needs to be covered. It all comes down to how they code things, right?
Oh, yeah.
So if it's not coded the proper way, in the way that they properly want to cover it, they can deny it, and they have their infrastructure to say, oh, well, see, this intestinal issue wasn't tied to this condition. It's a new condition, so we are not going to cover it. And they don't really care whether it is or not. That's how it's coded, and you're done. It's just an entire
there's nothing
level
medical
of bureaucracy.
about it. It's, and if a biller makes a mistake at some point and uses the wrong code, sorry. I mean, it was, and you have to, hospitals and clinics have to employ entire departments just to deal with this. Like, my last insurance stay got denied because it was coded incorrectly. So I had to call the hospital and say, okay, are you going to resend this with the new code on it, or do I actually have to pay it? And it's a convoluted, confusing system for anybody. Like, I have a lot of background with it, so I know at least enough to know who I should call to talk about it with. But if you're an elderly person, or you're just somebody who doesn't have much experience dealing with the healthcare system, the whole point is to try to get you to give up, especially with insurance companies. Like, they'll just deny you and hope that you don't know what to do about it and pay your bill. A lot of times that first denial is just standard. But then when you go in that second time, then they pay for it.
Well, let me tell you, like, if I can go back to my story, because I think it illustrates your point extremely well, actually, Amy. When we were trying to get our claim filed with our insurance company, we went back and forth, and I want to say it was 6 months before we finally got money for this thing that happened to my wife. And a lot of the confusion was around the Canadian system wouldn't code things in a way that they would pay. And I mean, I was like arguing with these people. They're like, well, why don't they just send over the coding thing? And I'm like, so you see that address there? It says Winnipeg, Manitoba, Canada. They don't use the same codes we do. They just do it. And then if we need anything extra, like we would contact them. So they denied the claim. Like they're like, oh, we'll pay for it once they code it. And it's like, they're not going to. They just, it's literally a foreign concept to them that we have to code things properly. So we actually had to send them x-rays and the notes from the doctor, and they had to build their own coding system on our insurance company's part to even pay this thing. They recognized that she had a X surgery done and Y thing done here and Z thing done there, but it wasn't coded properly, so they wouldn't pay on it. It was ridiculous. It was an entire level of delay, consternation, and honestly, it was more expensive because they drug the process out so long.
Oh yeah, and they had to pay someone to deal with that.
Because they had to pay someone to do. We were literally calling the doctor's office, like the receptionist, taking our money, and they're like, "This is so weird. This isn't part of our job because we're not used to paying or taking checks for $10,000, $20,000 from an insurance company." It was just ridiculous, and the Canadian system was far, far, far better. I asked the person at the hospital how much it would have cost us if we were a Canadian citizen, and they said, "Well, you had your 1978 for the medicine. We were Americans, and we had to get one of those knee scooter things, right? And we couldn't rent it. Normally they rent them or lend them out for like $30 or whatever. But we had to buy it because we're taking it home. It was $450 Canadian for that. So our total cost, ambulance, meds, and everything would have been about $50. Maybe 150 if we had to pay the full price of the ambulance. As it was, it was about $27,000 was billed between us and the insurance company, which of course we, like Amy said, we had to pay the deductible. You still pay your premium. I mean, the Canadian people I told there at the hospital about how much it cost us to get done, they were just taken aback. They couldn't believe that we had to pay a copay and a deductible and still pay our premiums on top of it.
The premium is the other thing. They're,
that doesn't go away.
Outrageous.
Aren't you? Yeah, that's what I'm thinking. Like, aren't you already paying these people?
Oh, fuck. You're paying way more than you are.
What are you even paying for?
You're paying for nothing. You're paying
for the privilege to pay a little bit less later. Yeah.
Yes. Exactly. You're paying for the privilege to not have to just in case you get just in case you have a heart attack and you need a really big surgery, to maybe not have to pay for the full cost of that surgery. Like, that's what you're paying for. And yet you talk to people and they worry about the government getting involved in it and the cost and who's going to pay for it. Who the fuck's paying for it now? You are. You're paying $400 a month just for the privilege of saying I have health insurance. You're paying the copays every time you go to the doctor. You are paying your deductible. You're paying all of those medication costs that don't get covered because the insurance company just doesn't want to fucking cover them. And doctors have less and less, say over what your care is. Like it's what the insurance company wants you to have. It's not necessarily what the doctor thinks is best. And so doctors are put in a position where they have to find maybe the next best treatment, or like my mom recently had to go to the doctor for some sort of GI type thing. I'm not going to get into it, but the condition she had, the doctor actually told her, we have a medication that will cure this. Like it was some sort of infection, and we have a medication that will, like, it'll cure it, but insurance doesn't cover it, and it costs $600. Or you can take medications just to help the symptoms, like, Pepto-Bismol or over-the-counter shit, and just leave and do that. And so my mom was like, guess I'm not curing it then.
Wow.
Because I don't have... And she said she could tell even the doctor was embarrassed to be presenting her with that. But, like, what's he going to do? That's the reality. It's a $600 medication, and he knows his patients can't afford to have a $600. So all of your choices are being made based on what can I afford and what can't I afford, Which is, it's why people can't make that leap to, would you rather pay a little more in taxes and get everything covered and not have to pay all the payments you're paying now, or have less in taxes, but then have all of these other fucking costs on top of it and arbitrary decision making?
Well, yeah, I'm certain that you're paying way more in other costs right now than
are.
Like,
it's been studied. We're paying so much more to get such like our health outcomes are abysmal, but we pay a lot of money to have those terrible health outcomes.
It's ridiculous. I get really frustrated, especially with the political season here. They talk about, they're going to take away your employer-provided health care. Like, I don't know anybody who loves, I really love Blue Cross Blue Shield. Oh, man, they're my pros. No, you just like maybe a little bit lower premium. But in reality, and I used to work in the insurance industry, and I live in a city that is really driven by the insurance industry, actually. And I can tell you, like, it's the overhead is ridiculous needed to just administrate these plans. And just for somebody to say they love their private insurance, they don't love their insurance. They like paying a little bit less than maybe they did before.
Yeah,
I'm pretty sure they would love paying
a little
zero.
bit safer. They feel like they're a little bit safer than other people, and that's what they love.
Than other people. That's the key.
Yeah. That is the total key, is that maybe I won't be in dire... Maybe I won't have to sell my house if my kid gets cancer. So they're happy with it in that sense, and that it's not worse than other plans.
It reminds me of back during the primary I think it was a New York Times podcast. They were talking to like the union reps from some Las Vegas unions that had fought for years and years and years to get their union healthcare plan. And so then they were like anti-Bernie because he's like, they're going to take away this healthcare plan we've worked for years and years and years to get, without ever really acknowledging that they are going to be getting something much better in exchange.
Make that leap. Exactly.
Well, because a big part of it isn't that they would be getting a better deal. It's that they want to feel better off than others. Like Amy said, I think you don't want to underestimate that aspect of it. Most of the folks would be fine with healthcare being more affordable for people like them, as long as somebody else has a worse outcome because they somehow didn't do the right thing or whatever.
Well,
that's a part of that mindset.
It really does feed into the whole idea of American exceptionalism and responsibility and self-sufficiency.
Yeah, and that whole individualistic society.
You're made to feel like a worse person if you don't have money. And if you're on Medicaid like I am, like you are definitely made to feel like a worse person because you're using a state plan and you're not providing for your family. You're not providing your own insurance plan, so you have to use the state plan. So other people are paying their taxes just so you can go to the doctor. And people get angry about that. People have, they look down on you because of it. Like
your
when
moral
I go to the
character
doctor,
is tied to your health somehow.
Oh, definitely moral character is tied to it, especially when you hear things like, there's so many people out there saying, well, if people would just take care of themselves better, then they wouldn't have to worry about all of these health problems.
And it's crazy because they talk about, taking care of yourself. Even if you do everything right, you're still paying how many thousands of dollars in health insurance premiums a year? Even if you never use it, you're still paying a lot of money. Yeah, come on.
Yeah, and they forget that, good exercise and a good diet and not smoking does not prevent all kinds of shit that happens to you.
Well, it matters, but it's not. That's not what's driving your healthcare costs.
You can still get cancer from random. Like it doesn't always come from something that you're doing. You just sometimes have health issues.
Well, they put so much of it on. I noticed this trend when I left I worked at a clinic for years and years, and I worked in the human resources department, and I noticed as I was leaving that the trend of healthcare savings accounts were starting to become a big thing.
Oh, okay.
And so they were pushing people, and they still do this, but they were pushing people to, just start a savings account, and it was just for your healthcare expenses, and you wouldn't be taxed on it, which was the benefit. And they had incentives so that if you put more money into your healthcare savings account, you were a better person, and you got discounts at the gym, and they really did tie it to character. If you got the right moral character, then you will put away the money you need to pay for your health expenses.
Yeah.
So just use that. And they were trying to transition out of insurance to giving employees just a health savings account.
Yeah, you're right. That's another example of that where folks are going to argue about the system and how if we just use the system better, it'd be better. But no, the problem is the system itself. You can give everybody the best HSA health savings accounts that exist, and it doesn't change the fact that they're not going to be able to pay the thousands and thousands of dollars that'll be necessary under this current system to get the care they need. Those decisions are still going to be covered by insurance companies based on the profit motive and really ultimately denying care, rather than actually having a well-prepared infrastructure so that everybody gets covered.
They don't make money by approving care.
No, they do not.
And they put tons of barriers in the place of actually accessing. So my son with his robot back, we asked before we left. In fact, we asked before we had the surgery, what things are we going to need to have at home when he comes home from surgery? When I've had surgery, I've had to have a hospital bed at home that we've rented. Are we going to need toilet seat bars? Are we going to need what's he going to need to get around? They cut his bag open from neck to tail. The thing runs along the entire length of his back. He's got 2 new titanium rods in his back.
Wow.
And the doctor actually told me, nothing. He'll be fine. He can sleep in his own bed. He'll be fine. Doesn't need anything. And I'm like, that doesn't sound right to me. And my husband has had several back surgeries and was like, yeah, that's okay. So we fixed up the guest room upstairs so that he wouldn't have to walk to the bathroom from his downstairs bedroom. So we got that arranged and realized very quickly once we got home that this kid can't move. He can't fully turn his body around yet. So when he would try to lay on his side, it took 2 of us to help move his body, adjust the pillows.
Well, did you give him the appropriate bootstraps? I feel like this.
We tried, but you can't. It turns out he can't reach all the way down.
Yes, back surgery could limit.
Right. So we had gotten him, fortunately, 1 bed rail because my husband had found it through an auction and it was left over, and we knew we'd probably need it if he had surgery. So we had at least that, so he could help get himself out of the bed. But after a few days, we were like, this kid needs a fucking trapeze bar so he can pull himself up and adjust his position. And so I called, my parents used to own a medical supply company, which is a whole nother fountain of horror stories I could tell you about healthcare. But
oh, I bet, yes.
They sold it years and years ago, and the only person I still know who works there is a cousin of mine. And so I called him, and I'm like, we really need a trapeze bar, just a freestanding, one that we can put under the bed. We don't need one attached to a hospital bed, but this kid cannot move himself, so we need it. And he's like, okay, well, so the doctor could write a prescription, but even if the doctor writes a prescription, Medicaid's not going to pay for it because you have to have a face-to-face visit just about the trapeze bar before they'll cover it. And since you're on Medicaid, I'm not even allowed to rent you one for cash because that's a Medicaid rule. And I'm like, okay, can we just buy one outright? Can we just pay cash for it? Yeah, we could do that, but it can't be a member of your immediate family that buys it. Somebody else will have to come in and buy it for you because we're not legally allowed to sell it to you because you have Medicaid. So I'm like, so the only legal remedy to this, you're telling me, is having my child who just had back surgery, neck to tail, that he needs to have a face-to-face visit again with his surgeon that he just saw last week, who's a 3-hour drive away from us.
Right.
So that the surgeon can say, yeah, he does need a trapeze bar, so that then Medicaid can cover it, and then we need this fucking thing today. He can't move. We need it now. And fortunately, my cousin has been working. He was with my parents when they started it. He's been doing this for 30 years. Like, he knows his shit. And he called me back and he's just like, you know what? I'm just going to take care of it. He's like, how long do you need it for? And I said, I don't like a week or two. I have no idea. He's like, just go over to the warehouse and pick one up, and I'm going to take care of it, and we're just not going to talk about it. Like, thank you. I appreciate it very, very much. So we brought it home and set it up.
And drain the swamp.
It is. It's fraud is what it is.
When you got to know somebody just to get your basic medical gear.
Yeah. Oh, yeah. You got to know somebody just to get and all because the stupid fucking surgeon was just like, nah, he'll be fine. He doesn't need anything.
But I mean, even that decision is probably still born out of the profit motive. It's still born out of needing to be compliant with the insurance companies. If it was something where he's just like, I know it's not going to cost anything to get this kid a bar, then I'll just give him the bar. It doesn't hurt anybody. It doesn't cost anybody anything. But since it does cost something, he has to hedge his bets. It sucks.
Yep. Yeah. It's outright. I spent all of Friday trying to get a refill on his pain medication and was sobbing by the end of the day. I literally was in my car in the Target parking lot sobbing because I had to, because, again, part of the problem with all of this is just politicians deciding they know what healthcare is better than doctors do. So
I think it's not the politicians. I think it's the people who like to put them there.
Well, okay, it's that. But it's the fact that politicians more and more often, you see it with abortion restrictions too. Like, they want to make decisions about what they think is the best based on the cost and how their rich friends are going to make money doing it. So right now we've had, because of the opioid situation, Minnesota has passed a law that is just, I could talk for an hour about it. It helps nobody. It doesn't help anybody not become an addict. It's just a pain in the ass for the people who actually need pain meds.
Right.
So I call the hospital because they told me when I left the hospital, here's the nurse triage line. If you need a refill on the meds, call this line. We'll get in touch with the surgeon. We'll get it taken care of. So I call that number. And I'm like, yeah, we're going to need a refill on these. Like, he's doing better, but it's only been a week, and he's still needing to take them, every 4 to 6 hours, and we'll run out by Sunday if we don't have a refill. And she's like, okay, well, let me talk to the surgeon. So she calls me back. Yeah, the surgeon said that's fine. You'll have to come pick up the prescription because it's a controlled substance, so you have to get the paper prescription. And I'm like, okay. I said, we are a 3-hour drive away from you. Like, it's a children's hospital in St. Paul. We don't live in St. Paul. And she's like, yeah, I don't. You have to pick it up.
You can't fax it?
And I said, yeah, no, well, and I said,
it's
are
a moral
you sure?
failing that you don't live in St. Paul.
No, I said, could somebody call it in? I said, I'm pretty sure doctors can call in. She's like, yeah, no, none of our doctors are signed up to do that. So I called my pharmacist because we go to a small family pharmacy and they know us. And I called the pharmacist and I'm like, why would they not be able to call it in? He's like, that's total nonsense. They should be able to call it in. I don't know what the fuck they're talking about. So I call back again and I'm like, are you sure there's no way to call it in? And she's like, no, his doctor doesn't do that. And I said, okay, so is there another doctor in the practice who would be willing to write it if he speaks with the surgeon? Because apparently you have to be signed up through some kind of state system to be allowed to call them into the pharmacies, and these doctors hadn't signed up for that yet. So I'm like, could you, maybe a different surgeon in the practice? Yeah, no, we don't do that. And I'm like, okay. I said, how about if if I were to call my family doctor in town where we live, I said he's got a family doctor who saw him for a pre-op physical. If I were to call her, could she write the prescription if she talked to the spinal surgeon on the phone and, went over it with him? And she's like, oh, yeah, that would actually be a good solution. You could do that. So I call the clinic. And I leave a message for the nurse of our family doctor and explain what's going on. And, could you write the prescription? I have a phone number. You can get in touch with a surgeon. Otherwise, I'm going to be driving 3 hours to St. Paul. The nurse went to lunch, didn't call me back for an hour and a half. And, it's a situation where if I'm going to go pick it up, I need to go now. They're going to close. Yeah. And I'm going to... So she calls me and she's like, yeah. That was more important in my opinion. Was on lunch. And it was a Friday afternoon. So she's like, yeah, I talked to the doctor
audacity.
And she said, just call them back and tell them to call it into the pharmacy. And I said, well, I asked them that twice. I even mentioned it in my message. I said, they absolutely will not call it into the pharmacy. Well, then tell them to fax it. We do that all the time. They can fax it. I'm like, is that a legal thing? You can fax it to a pharmacy? She's like, yes, we do that all day long. They can totally fax it. Okay. So I call back the hospital. Can you please fax the prescription? Oh, yeah, we don't do that.
Of course they don't.
This is
And I said, I just talked to my doctor's nurse in Brainerd, and she said that they fax those prescriptions all the time. And she said, oh, I'm sure they do up there, but we don't do that here.
Wow. Wow.
And at this point, I'm just I called the clinic back sobbing and talked to some poor receptionist who was very nice. And I'm just like, I know this isn't your fault, but I don't know what to do. And I need to talk to the doctor again. So she got me on the phone directly with the nurse again. And I'm like, they won't fax it. I don't know why. And she's like, but that's dumb. Just tell them to do it. I'm like, I tried. They won't do
bureaucracy.
it.
It's all
I know you don't believe me, but they won't. And she's like, well, I don't. She said, the problem is that because it's a surgical follow-up, the surgeon needs to do the follow-up. And the doctor doesn't think she's even legally allowed to do it because she would have to have a visit with him first. And I said, okay, how about this? How about if it comes to it, could we do a video visit? Because I can turn on the computer and put my son's face in front of it. And video visits have become much more, since COVID.
Right.
They're totally doable. And she said, yeah, the doctor doesn't have any more appointments open this afternoon. And
it's like that meme where the entire healthcare system is that meme where the person's riding a bike and they stick the stick in front of their own front tire and then they curse. That's exactly what's happening.
And she told me, she's like, and I'm basically on the phone crying, just going, I don't know am I supposed to take him to the emergency room then if he's in, I don't know what I'm supposed to do. And she said, well, I'll have the doctor, we're going to have to figure something out. I'll have the doctor call the surgeon. Just, give me a few minutes. I'll call you back. So I finally get a call back from the hospital, the same woman I've been talking to all day who has been telling me we don't fax things, we don't call things, other doctors can't write it. She calls me and says, so we found another doctor in the practice who's able to write that prescription for you. Which pharmacy would you like it called into?
Wow.
And I'm just stunned.
Yeah.
Okay. This pharmacy? And she's like, okay, I'll call you back and after I talk to the doctor. Then I get a call from the nurse at the clinic, the family doctor's nurse, saying, I just talked to somebody else over there and she said they can send it however they want. So just call them back and talk to this other person. Her name is also Amy, ironically, but just ask for her and she'll take care of it. And I'm like, okay, well, they just called back and told me they found a different doctor that could do it. Oh, okay, well, that works then. Never mind. So she calls me, the fucking bitch from the hospital calls me back. So our other doctor is willing to do it. She will write him 12 tablets. Usually we like to see you weaning them off of it, even a few days before this. And I'm like, so the day he left the hospital is the day you want? Because when we left the hospital, they said, make sure you stay on top of his pain. He's got a lot of pain. Just give him this every 4 hours. Make sure you do the Tylenol every 8 hours, and then here's how you can start weaning him off of it. You can lower it. We had all of this covered. When he is feeling more comfortable, we will start weaning him off. But just the fucking lecture I got about it was like, oh, okay, so I'm a bad mom because I assumed he needed pain meds 5 days after you cut his back open.
It's all bureaucracy. Like, if it was something where it was just about what's best practice, they would have been sure.
Nobody gave a shit about the best practice
safe,
at all.
You know,
it was just following the rules, following the law.
Exactly.
That some country bumpkin fucking state representative that I have, who is truly one of the dumbest people on the planet, voted for. Because he heard one of his colleagues in the Senate tell him a sob story about someone who got addicted to opioids, and so he just signed this law that made no sense and doesn't even know what's in it. And
right.
Yeah.
By the end of the day, I'm like, I'm going to stab somebody, so who should it be? I don't...
Well, make sure they have insurance.
Well, yeah,
make sure they have insurance first before you stab them. You know,
That's
you want to be
true.
responsible. Yes.
No, I don't want them to be
No,
healthcare
fuck
after
'em.
that. I just want them to die. I just...
Yeah, it's like the mantra of the rural. I mean, I'm in Iowa, and it's like the rural person is socialism for me in the form of farm subsidies and but austerity for thee. You don't need that extra $200 in food stamps, but I do need this extra $20,000 for my farming business, quote unquote, so I can buy a 2020 Ford F-150 for the farm.
Absolutely.
Quote unquote. You know, so it's ridiculous, and it pisses me off.
It's also like, again, I'm a better person because look I've got this thriving farm that you got subsidies from that kind of subsidy is okay.
Yeah.
That makes you a better person.
There's nobody subsidizing the person that runs the gas station down there, but you need a subsidy. You need a subsidy.
Yeah. But that person that needs that $200 in food stamps whatever reason.
Lazy. Get out of here.
Fuck
they're
them. They should
just
be
a bad
working at
person.
McDonald's. They're just bad. They're lazy. If they weren't so lazy, they'd get a job.
That's right.
Like, I know
it's
there's a
insane to me.
pandemic, but suck it up.
Yeah, you got to
go get a job.
Yeah, go risk your health. It's too bad.
And that's what's crazy. I mean, having been in Canada for that period, and I mean, we were there for 5 days. She was stuck in the hospital for 5 days, and we didn't have any of that bullshit. You know, the biggest argument was whether our insurance company was going to pay for it. But I legit, we got worse care and we got worse services, not because of a Canadian system, but because of the American one. And it's super frustrating to know that some folks will rail against the Canadian system somehow being more inefficient or not as good when the coverage we got there was just better, and it was systematically better, not because we had a nice doctor. Like Amy just talked about how she had to go like an end around to find a decent doctor. You didn't have to worry about that because all of those traps and that red tape just wasn't there, because all that red tape that you had to cut through was for profit. Whereas here it's about, or here in Winnipeg, it was about the proper service. Yeah. And the hardest part was dealing with the Americans. And the doctors can focus on that. Yeah, the doctors can focus on So I'm curious, Cory, what are the things people complain? Because I know people complain about the system. Everybody does. Human. So like, what are the biggest complaints that Canadians have about their own healthcare system?
I guess the one that you'll hear from like conservatives or right wingers is a lot of the they talk a lot about wait times. They really I don't know. They like to focus on how long you have to wait if you have to have a hip surgery or some surgery that's for your mobility or whatever.
Oh, we don't have to do that here.
Yeah, I mean, I had to wait, I think 3 months or 4 months I had a hernia surgery a few years ago. I had to wait for that. But my kid had to wait for his robot spine for 3 months. Right. Yeah. Like my dad had.
We wait here, but it's because the insurance company is deciding if they want to pay for it or not. That's the reason for the wait.
Yeah. The waits here are a product of like, well, if somebody's got a life-threatening issue, then we put them at the top of the list.
Yeah. It's probably triaging.
Yeah. So like my dad had lung cancer and he had 0 wait time. All he had to do was like, once he was diagnosed and they assigned him with a chemo specialist, and once he knew what was happening, he started getting chemo like within a month, right? So the wait times there's a reason for them. It's not because the system's inefficient. It's because, like you say, like it's proper administration. It's proper like
it's like when you go to an ER and they're gonna let the people that are most horribly injured in before you if you got stung by a bee. Like, it's just
Exactly.
that's what triage is.
That's a weird. That's a weird
of.
thing to hear from a Canadian point of view, I guess, because like in America they say the same thing. You know, they're worried about the wait times if we go to the socialized medicine and it's evil. But I mean, like you said, if you have more people getting coverage, I think it's reasonable to say that there might be a longer wait for less serious things. But it's weird to me that a Canadian would argue that, a conservative Canadian would argue that, when you can look at America and see that the wait times are just as long or longer, and there's not as many people getting the coverage.
No.
So doesn't that blow their entire argument out of the water when people still have to wait and they don't have socialized medicine?
You know as well as I do that you know as well as I do that facts do not matter in these discussions.
That's fair.
The truth is not an issue.
It'd be different if America had super low wait times and they're like, oh, that looks awesome. Everything else is awful, but at least the wait times are low. But that's not even true.
Yeah.
Oh God, no. And like I said, I would rather have the wait time be because somebody else was sicker and actually got to be taken care of than because Blue Cross Blue Shield was weighing whether or not I deserve to have my surgery that I need done. Because that's all the wait time is here. Is your insurance company going to pay for it? And if not, then how are you going to pay for it? Because we need to make sure it's paid for before we move ahead with anything.
That's the only reason my wife didn't get treated that same day. Literally the only reason. The surgeon was ready to go, but he wasn't authorized to do it because he didn't know if he had to clear it with the insurance company. It's all entirely self-inflicted.
Yeah.
It's almost like, now bear with me here, Amy, it's almost like capitalism is the problem or something. I don't know.
I keep telling you not to say that part out loud.
Yeah, but now I've implicated Cory in it. So
God damn it. Yeah, when my husband had to have one of his surgeries, he actually had 2 different workers' comp companies fighting over who was going to pay for it because he had 2 separate injuries at 2 separate employers.
Jeez.
Which meant that those 2 separate lawyers for those 2 separate companies, for those 2 separate employers, fought out for a year who was going to pay for his surgery. It went through the court system for an entire fucking year while he waited and got worse and worse and worse. And after a year, we finally got a judge to just look at one of the companies and go, you're paying for it, fight it later.
Yeah.
So that he could get the surgery. A judge had to make that decision so that then we could keep fighting it out for the next several years about who was going to pay. But he had to wait an entire fucking year. Like, when we got married, he was waiting for that surgery. We had to have a 10-minute ceremony just because he couldn't stand up any longer than that. And yet that's okay, because at least it's not the government deciding that you have to wait somehow.
You say that ironically, but people will literally say that.
People will say that, yeah, because they think
Yeah.
I can't vote out the people running Blue Shield. Blue Cross Blue Shield has a board of directors, and I have no say over who they are or what they do. Whereas
you can come down here and punch them in the face. We have a huge, well-marked Blue Cross building here in Iowa. You know, I can tell you where
that
they
would
are.
feel very good. But like in theory, I have the ability to get rid of the people in the government that are making the shitty choices. In theory, we all know it doesn't work that way because America is colossally stupid.
Because
Confirmed.
Representative democracy is a farce.
Yeah.
It doesn't have to be. It doesn't have to be, but it currently is. Yes.
Mm-hmm. Oh, it's ridiculous. I am so. The election is coming up in 2 days. And I almost want to
Wait, that's this year? What?
Yeah. You need to go vote, Jason. Hasn't Facebook told you about voting?
No, I thought that was all next
know
year.
what
I was
voting
blowing
is?
it off.
Do you know how to vote?
No?
Do you know where to vote? Can I help you make a plan to vote?
Oh my God, stop.
There you go.
Facebook's driving me. Like, clearly you don't know me, Facebook. I have voted in every fucking election since I turned 18, even the boring ones. I promise you I am voting. You can lay off for a little bit.
Yeah, you'd think that the algorithms and all the Google surveilling everybody would realize the people that are talking about this all the time, they go vote regularly.
Yeah, they're not the ones you need to worry about.
Stop with the ads already.
We're fine.
Yeah.
We're all voting. I promise. We're all shaming each other into voting. We're not the ones you need to worry about.
As it should be. As it should be.
I have so many friends I have to shame into voting. that makes me curious. So elections, I assume, do you guys have elections, Cory?
Oh, yeah.
Does the Queen still own Canada? I don't know how that works.
Yeah, no.
They probably still have the fealty pledge to Stalin up there, as you know.
Yeah,
Yes, go ahead, Cory.
It's not a socialist dictatorship. No, we actually have representative democracy, though it's a slightly different system than you have. It's a parliamentary system.
What's your voting? If you even know, what's the percentage of the population that actually shows up to vote?
Oh, it's not good. Yeah, like it's less than 50% usually.
Oh, wow.
Yeah.
That's worse than America.
Yeah,
Holy crap.
we actually just had a provincial election here in Saskatchewan, and I think it was like 45% of the eligible
That's awful.
voters. Yeah.
Wow.
Well, that's the thing people don't realize. You're letting 40% of the population make your decisions for you.
Yeah.
There's so much more power to be had, and you're letting a minority of people decide what's happening in your life. I
have unironically considered running for office and
me too.
having the
Many
cornerstone
times.
be 1, vote shaming, and 2, be ranked choice voting. But
Nice.
I don't think it's crazy to say if you're having a rally or a town hall or whatever to ask people if they voted, and if their answer is anything other than yes, you make them give up the microphone. If you don't vote, you didn't get a chance in the election. You don't have a say. You don't have a say now. So your opinion
rallies
doesn't
don't
matter. Yes,
your protests don't matter. If you're not voting,
doesn't matter.
What the fuck are you out there? You're just making a spectacle at that point.
Yeah, you're a waste of time, in my opinion. I get really mad about it, actually.
Yeah, so do I especially considering, at least in America's history, women have only been allowed to vote. This year was the 100th anniversary of women being allowed to vote. 1920.
And look, the global temperature has increased. Coincidence? I think not, women.
I keep telling, we are all witches, but we're not supposed to talk a lot about
Correlation is causation here. Mm-hmm.
Hillary Clinton is our cackling witch leader. Yes, it's true. I'm confirming it for everybody. So yeah, I'm excited to see Trump's awesome healthcare plan. He promised it to us 4 years ago, and I haven't seen it yet. But I'm sure he's just waiting until
it's
after
just
this
around the
election
corner. Yeah,
to bring it out. Just like our
you got to vote him in to see what it's going to be, right?
well, we don't get
He
our
hasn't had a
stimulus checks
chance.
unless you
He hasn't had a
either.
chance.
So yeah, he's holding our stimulus checks hostage. So if we don't make the right decision. Where I come from, they call that blackmail, but...
Whoa, why do you have to bring race into it? Jesus.
Oh my God. You have no idea how...
Yeah.
Oh I can't even. America's the worst. Living in rural Minnesota, the number of times I hear, why do you have to bring race into everything, is outstanding. People just... If you go to any newspaper article that mentions anything about a black man being shot by the police, your first
you don't
comment
wanna
is
do
going to
that.
be, why do you have to keep bringing race into it? It's
don't
not
go to the
about
comments.
race.
Yeah, it's awful. It's awful. Yeah, you're right.
I have a problem. I have to go to the I can't not do it. I have to do it.
It really
compulsive.
makes me depressed. I live
yeah.
in the biggest city in Des Moines, here in Iowa, and it's tough sometimes to realize that there are a lot of people outside of the cities that really are okay with regressive, racist, and fascist policies, and it's not.
They live here in my town.
Yeah, it's not something where it's like, oh, they're just confused. Like, no, they legitimately don't want black people to not be shot. It's awful.
They're terrible people. My husband, he gets mistaken for a Republican frequently because he looks like a Republican. He looks like a very average,
That's mean.
rural white guy with a plaid shirt on, and he's just, of course, he's and he said, and usually he tries not to talk politics at work. He's just like, a lot of our customers happen to be fucking Trump-loving Republicans and whatever. But he's like, I finally lost my shit on somebody the other day. Because he said he drove up and he was listening to Rush Limbaugh and he was laughing about how those dumb fucking Republicans and their health care. He's like, so I just let him have it about health care and about how, if pre-existing conditions weren't covered, my family would be dying because we all have pre-existing conditions. And if we didn't have,
it's just insane. It's insane how a party can talk about and even run an ad about pre-existing conditions, which shouldn't exist in the first place.
Shouldn't exist at all.
Even if we're going to work within this system, to have one political party in the United States actively suing in the Supreme Court and other courts to take away protections for pre-existing conditions, and then the audacity to go out and say like, "Oh, we care about pre-existing conditions." It's like, but and these voters, these Republican voters, like they don't know it. Like they don't know it or they don't care, and I think it's both. I don't know how you can sit there and say that Trump cares about your pre-existing conditions when he has sued like 8 times in the last 6 months to get them taken away. What do you not care? Do you really not care, or do you just care more about racism than you do anything else?
I think it's that Trump has really done a good job of fostering that climate of cruelty.
Yeah.
Like, it's just, a lot of it is just fucking open cruelty and laughing. It's, people love to own the libs, and you own the libs by not being...
intelligent?
Well, not even that. You just, by being mean. They're just fucking mean people, and they thrive on that, and they think it's funny. And somebody posted something in one of my liberal groups about how, you know, these people don't give it. They know that Trump's not like them. They don't care. They think it's hilarious that he says things that piss off liberals because they hate liberals.
Yeah,
that's all it's about. It's about hating liberals. Because liberals they see as weak, and they don't like things that are weak.
I mean, Trump is not the cause. He's the symptom, in my view. I think if they had a more eloquent leader in the Republican Party, I think it would be much worse for us as human beings. But I think there's a lot of energy spent on bashing Trump and all his silly gaffes, when really it's the people and the Republican Party who is okay with him doing literally illegal and awful things because it helps them win elections or whatever.
All Trump did was allow them...
Not Trump.
Yeah, all Trump did was allow them to say the things out loud that they have been thinking and that they were too ashamed to say.
I mean, Rush Limbaugh has been on the air for how long, right?
Yeah.
So
Trump is like the insides of the horrible Americans being personified, climbing out of their bodies and taking all of that meanness and hatred and then turning it into a person. That's all he is. I mean, really what people are saying when they say they love Trump is, I love being able to say whatever the fuck I want to say about anything at any goddamn time, and I'm sick of people telling me that what I say is racist. Yeah. And fuck you. That's all it is.
I always tell folks, if you don't like being called racist, I get it, but I think the first step really is to stop being racist, and then maybe people won't tell you that anymore.
That's the thing. Like people believe that being called racist is an insult on the level of racial slurs somehow.
Yes. Yes.
You know.
Yeah, you're right.
And they think it shouldn't be. That's the whole thing. They don't like being shamed for saying they think that it is ridiculous to shame somebody for saying a racist thing, and they think that racism, they have such a narrow view of what racism is, especially up here in northern states, because we like to pride ourselves on not being the South. So, like, we weren't out lynching people. Like, we didn't have slaves. We weren't Jim Crow era like, we're fine, right? We're not racist because we didn't do any of that shit. We didn't have...
I think that saying where they say we're... in America, especially, and I apologize to anybody listening if they're a boomer, but the boomer mentality of not talking about religion and politics has made it so people don't know how to talk about religion and politics. So any mention of it is seen as somehow offensive or beyond the pale, when in reality, asking somebody, hey, do you think that, for example, black people shouldn't be incarcerated more than white people? They would say, no, I don't believe that. So then let's support a policy that does that. Well, now you're making me, it's all politics. Well, I don't want to talk about that.
That's when they say, well, then they shouldn't be committing that many crimes. Like,
right. It's all, they believe in the system and the status quo so much that every conversation that would change that is seen as extreme, when in reality, it's just reflecting what's actually happening. It's not extreme.
Yeah.
Well, the system has worked for them their entire lives. Like, if you are a white person in America, for the most part, that system has worked for you.
Yeah.
You haven't had to deal with the criminal justice system. You haven't had, if you did some shitty thing as a teenager, you got a slap on the wrist and nothing serious happened and you got away with all kinds of bullshit. So you do think these people are here to protect me. They're the good guys, right? Like, why would I not believe they're the good guys?
They're here to protect the capital.
Trying to tell me, people trying to tell me that those are the bad guys, those are bad people. And I'm not going to listen to them. And they just want to be able to commit crimes and do whatever they want. So, and
be gay, do crimes.
To a large extent, they just never have to think about it. Which, Yeah.
Which they prefer, right?
Which they prefer, which is why they say quit bringing race into things, because they don't want to have to deal with it. That's for God's sake, that's why they live in an all-white town.
Yeah, that's
If
fair.
they wanted to think about race, they'd go and live with other people, but they don't wanna.
We just had an election, like I said here, and the Conservative Party won the provincial leadership, and one of the things that even lefty people here have been trying to figure out is how can we get more people to vote for our team? How can we win against these guys? Mm-hmm. And one of the things that was brought up was we need to stop with the identity politics. It's obviously not winning for us.
Oh my gosh! Okay.
Yeah, and it's that same mentality just transplanted onto the now because my team didn't win, we need to stop talking about race, right? Like, it's an issue whether it's my team or their team. I don't care. Like race needs to be a part of the conversation, right?
It's just another way to say I'm tired. Why do you keep bringing up race? I'm tired of talking about it, because we're allowed to be tired of talking about it because we never have to talk. Like, it's one of those things that the past several years I have gotten so much more opinionated about, I guess. Radicalized could be the word, in that racism is truly, if not the number one problem in America, one of the top problems in America. And if you had asked me 10 years ago, I would have been like, yeah, I mean, it's a big problem, but I mean, things are way better than they were before. So why, but the more you put yourself out there to learn from people who actually know what they're talking about and put forth the effort to find out what life is really like for people who don't live in your little small white enclave, you just realize very quickly how fucking racism pollutes every single thing in this country.
Mm-hmm. And it's systematic. It's that's the thing.
Horrible. Yeah, and it's going to take, I don't even know what it's going to take to fix it, but we need to fix it. And
ignoring it isn't going to do it, right? Like,
no, ignoring it does not help. And pretending that I'm not racist. I've never said anything racist. I'm not, constantly getting into defensive mode like that isn't going to help it. That's not going to fix it.
Yeah.
Honestly, I wouldn't mind if people were in a defensive mode if they were willing to just take it seriously and acknowledge that it's a systematic thing. I mean, you can look at something that nobody should have any argument about, like the disproportionate sentencing regarding crack and powder cocaine. That I don't think there's any person in rural suburbia or whatever who's a connoisseur of crack cocaine policy. There's like no personal stake in that, and yet you can get those people to vote against changing it despite their not quote unquote non-racism. I think it speaks less to their racism and more their inability to comprehend information, and that's what's scary to me.
Well, I think the system perpetuates itself too, because you see a higher percentage of black people in prison, and so if you decide to do zero thinking about it at all, your assumption is just that they commit more crimes, right?
Right, exactly.
So that makes it worse. That continues the racism, and you continue ignoring it because you're like, well, they should stop committing crimes then, and it'd be totally fine.
Well, and there's been decades and hundreds of years of like propaganda essentially that says like these people commit crimes. These people are less than you. Like,
they are criminals.
They of course they're in jail. They commit crimes.
It's like if I may use another analogy, it's like what's his name in not Bender. Oh, geez, why? In Futurama, where he finds out where Slurm comes from and finds out how disgusting it is and how everybody shouldn't drink it. It's unhealthy. And then at the end, he still wants to drink it because it tastes good. That's very much like you could come out at these folks and show them, like, look at how disproportionate it is. Look at how unfair it is. Look, you can see here's the Lee Atwater quote from Nixon administration where he specifically, intentionally laid out why it is the way it is. And then they'll be like, oh, that's horrible. So how can I get more of that racism, please?
Yeah.
Like, what? Come on. Like,
but that white supremacy, it tastes so good.
Nobody wants to do the work to change it. That's the whole thing. Like, I'd rather keep being comfortable. It seems like that's a bad problem they have over there, but that's not affecting me.
It's not me. Yeah, so I'll vote for the Republican here who will then allow it to happen more. So yeah.
Well, and especially when, like you said, like when it's framed as a city issue versus like, and you're talking to rural people.
Which it very much is.
So
Well, yeah, rural people believe that if you go to a city, you're going to get shot on site just for being on a street.
Right.
Because
I mean, it's
that's
true.
what cities are
It's
like.
true.
And now that you have this brand new narrative of rioting, which,
Right,
let me
yeah.
tell you, they are latching onto that
Oh,
in
boy.
rural America. The cities are burning down, and the Democratic mayors are letting their cities totally burn to the ground, and it's just the rioting narrative has taken off
Yeah.
so much.
That's Fox
And
News,
people
right?
who-
It's strange
Oh,
to
yeah.
me too because
That's-
they're riding, quote unquote, riding in the cities and living in one of the cities, and I
Yeah.
know that's not what happened. But isn't it ironic that the riding is happening in the cities? That's where the quote unquote unwashed masses want to be. It's funny they're not riding in your small town. Why is that?
Why is
Why
it
don't they
both?
want to be there?
Well, because you know what? We all follow the law like we're supposed to. We keep things
Because there's
simple.
nothing for anybody there except for
We make sure it's
well-landed
only
people.
white people here, and we like it that way.
Hmm.
So, yeah, rural people's idea of what a city is just holy shit. I
Yeah.
can't even. They truly believe that it is like Gotham, and there are villains on every street corner. And that Democrats are just somehow purposely fucking everything up and they think everything's run by gangs and
Oh, yeah.
mobs and just
Yeah,
It's
even
like the Republican trope where they make Democrats out to be way cooler than they actually
yeah, that's right.
exactly. Like I wish we were that effective.
Yeah,
My God.
like even my dad up
wish we could
here,
get
he
socialism.
buys into that narrative that like all the cities that are having troubles, all the cities that look like they belong in quote unquote third world countries, it's because they're run by Democrats.
Oh yeah. Yep. Like
That's interesting.
we talked a little bit. We did a live stream last night, and we were talking just a little bit about this. And it's like most cities are run by Democrats because that's just kind of how politics works. Like cities tend to be more liberal
Right.
than rural areas do. But it's not like so first of all, find me a large city run by a Republican to start
Well,
with.
if
But
I
it's
may,
not like cities are just going, oh wait, nope. We're run by a Republican. We can't have protests. Sorry, they're
Well,
not.
it's like there's like, oh wow, look, Minneapolis had 10,000 cases, whereas my small town only had 400. So clearly the city's wrong, even though your city only has 10,000 people. They look
Yeah.
at the raw numbers and think that's somehow a justification for badly run cities when it's like, hey, there's 1 million people that live here, not 2,000.
Yeah.
It's a little bit
Minneapolis
different.
is not that. It's not that big.
Yeah.
But it was run by a very sexy Democrat. So Jacob Fry is not hard on the eyes. I'm just saying. But yeah, I don't know. Democrats ruin everything, I guess. And
You should see that chart where it shows the red states and the blue states for coronavirus cases, and
Oh,
it starts
God.
out with the blue states, because they have the big cities, right? So they start at the top, and as time goes on from April to I think it goes through September, the red states just filter
Yeah.
to the top. Just
Oh,
the
we're
red
hitting our
states
peak
filter
right
to the top.
now.
It's ridiculous.
We are
how
hitting the peak
bad.
in our town right now, and I am terrified to leave this house. And nobody will wear a mask.
That's
because
why.
at this
That's
point
why.
it's become like a rallying cry. Like you're weak and you're afraid if you wear a mask. So not wearing a mask has actually become a point of pride.
Dying of coronavirus to own the libs.
Right.
And it's all and they buy into the conspiracy. It's only 99.7% of people are just fine.
Yeah.
Like, okay, your stat is wrong to begin with, but even if just because those people survive, doesn't mean that the people who survived but got it were totally fine and never had issues after that.
Yeah.
And we're finally hearing from our local hospital, which I've been waiting for since March for this to happen, but our local hospital is full now. The ICU is full with corona cases.
That's scary.
It's not a very large hospital, and if I have to go to the hospital for something, I'm going to be fucked
Yeah.
because there's no beds there. We need to start giving a shit about that. But yet you have all of, if you read like newspaper comments from all the people in the community, why do we keep focusing on this? People need to quit being afraid. We die. It's what we do. You got to die for something. I mean, people get the flu every year.
It's such a callous
That's truly
attitude.
the argument. Oh, yeah. It's truly like, look, people live and they die. Like, if we keep being afraid of something, you can't live like that. That's terrible. And meanwhile, the rest of us can't leave our houses because if I try to go to a grocery store, at least half of the people are going to have, they're going to be dick nosing is what we call it.
Yeah.
Where the mask is under their nose. So, like, I can't, it was weird to be down in St. Paul before my son's surgery and seeing everybody wearing their mask correctly. Like, we had to stay at a hotel for one night and it was just, we looked around like, holy shit, they're all like, and it's over their nose even. They know what they're doing. Oh my God.
Yeah.
Because, here it's not like that. You can't, nobody know. Yeah. So basically, I'm going to hide out in my house for at least another 6 months. And continue
at
hating
least,
people. So, we've gone way over our typical time, which is fine because people have zero expectations for the show in any significant way. Cory, do you want to plug the things you're doing right now? And
sure. I guess my Twitter is at Hardcore Skeptic, and that I post all my episodes there. You can find us on pretty much every podcast app. It's I've got The Mind of a Skeptical Leftist, I've got Skeptarchy, and I've got it's called From Many People's Strength. If anybody cares about very small provinces politics.
Nice. And if you send me a link to those in our message, I may remember to put them in the show notes. So people listening,
I could try that.
That's
you
a
could get lucky and actually read this in the show notes. Jason, do you want to send us off with railing on about capitalism?
I mean, most of the problems
do you have thoughts about capitalism?
Most of the problems we're upset about are caused by capitalism, but being as it is, make sure you voted, since you'll probably be hearing this after the election.
I'm going to try to get this out before the election. We'll see.
Oh, wow.
Keep your fingers crossed.
Hopefully, yeah. Vote for the Democrats. They are the only choice we have against fascism, basically, at this point, which is good. I am the vice president of Iowa Atheists and Freethinkers. You can always give us money and become a member, which would be awesome. We are planning on doing some other things to raise awareness socially distanced since the coronavirus has really messed up all of our get-togethers. And, again, make sure you're registered to vote, and you're going to have to vote in every election from here for the rest of your life if you really want this democracy thing to stick around.
Yeah.
Nobody wants that.
Don't be a baby and vote for the Libertarian. Just don't. I'm sorry, but jeez fucking Christ. Just stop. Just stop with Libertarianism.
It's a two-party system. It's dumb. It needs to be changed with ranked choice voting. But as it is, the only moral stand you're taking is just screwing other people up if you keep voting third party. So vote for the Democrats and then work on third-party elections. Down ballot.
Yeah, I was going to say down ballot. Yeah. Vote for your local races. If you don't know who to vote for, ask somebody. Those elections are very, very important. So,
also abolish the
2020, Senate. Abolish the Senate. I'm with you on that.
Yeah.
Yes.
Let's ban men from any sort of leadership. I want to see an all-female House of Representatives. Not the Amy Coney Barrett kind, though.
You gotta watch out for that tokenism.
Yeah, that's true. Well, thank you both for joining us. I will put links in the show notes. Hopefully everybody understands a little bit better now why Canada is a hellscape. And you should go there.
Never come here. Unless
my wife died. My wife died because of that. Because of Canada.
Right.
Yep.
Yeah.
Mm-hmm. Yeah. All right. Thank you both so much for coming on. Talk to you later. Bye.
Bye.
That's the noodle to brag.
And it's that time once again to thank our patrons. If you would like to become a patron, please go to patreon.com/secularsoup and join our Patreon family. I'm going to read the patrons with a little bit more flair than Amy with an I does, because let's be real, I'm the one that has all the flair. And I'm just a little bit better than her. So, I don't know. She's going to have to deal with that. So our shout-outs this week go to, first of all, our newest patron, Daniel Kirsten, who, when I saw this one, I thought, I actually texted it to Amy and went, oh my God, this one's a big one, just because I recognize your name. Daniel is king of all the podcast groups on Facebook. Well, maybe not king. but someone who I've, seen around so much on Facebook that it was nice to see that familiar name join our Patreon page. So awesome. Thank you so much, Daniel. We see you and we appreciate you. So the list of our Devil's Chili patrons, which are the people who donate at $6.66 a month and higher, and this is the point at which we start giving shout outs, are Nuggin, Maddie Love, who increased her patronage. We see you too, and we so appreciate that. We love Maddie. We talk about it more than we really should because it's weird, but we both love Maddie so much. We also have Justice for Breonna Taylor, No Justice, No Peace, who is our friend Alice. We have Natalie, who wrote the intro song for I Date Me, which is our other podcast. Go check that out. We've got Life in the Left Lane podcast. That would be Tom and Austin. We are working on reuniting with them for another show because we had so much fun the last time we did it. We have got Paul, who I talk to once in a while on Twitter. He's awesome. Shmishtina, sorry for mispronouncing your name, Shmishtina, April, and Lois. So those are all of our Devil's Chili. And Andy, because Andy never gets put into the goddamn list. I have no idea why. Patreon hates me. It's the worst. Anyway. Or maybe Andy's not in Devil's Chili. I don't fucking know. Either way, we love you, Andy. He's amazing, and I love him. So we've also got our Lobster Bisque level, which is $10 a month or higher. At this level, you get a personalized soup bowl. I finally got the soup bowl out to Renee. It was a long, epic thing, but it finally happened, and I'm very proud of myself for that. So if you become a patron at $10 or more a month, we will shout you out every week, and you'll get a handmade bowl by me eventually. Just don't count on it coming super quickly. We're also working on doing some better patron rewards, like t-shirts and shit like that, because now that we have a threadless shop, that might be a little bit easier. We just need to figure out the logistics. So if anybody wants to do that for us for free, let us know. We love people working for us for free. So anyway, Lobster Bisque people. Wendy, Verlaine, Elvin Engineer, Renee, and Patty and Selma Bouvier want you to please support Humanists International in the National Adoption Center. So please do those things. That's our friend Freethinker 215. And because today is November 3rd and it is the biggest election in my lifetime, and I need something happy to cling to, and because this person actually sent me a private message to tell me to be safe today, I am going to label him our third favorite Rich. You're welcome, Rich. At the $20 a month level, that's our blueberry dessert soup, our finest, fanciest level. Once again, we have our all-stars Randall, Ashley, and then our two competing top patrons. Coming in at number 2 is Sarah Bullied Me Into Changing My Name. Wait, no, I fucked that up. That's our top patron. Our second top patron is I Still Don't Like Twilight, but I Understand It a Lot Better, which is Nathan, Podcast Historian. I don't know why you guys give me these names that are impossible. Just call yourself Nathan, Podcast Historian. We all get it. And Sarah Bullied Me Into Changing My Name. Really, Willis? You're bullied that fucking easily? Like, I have no respect for you anymore because apparently you can be bullied into changing your very own name. So those are our patrons. Thank you so much. We would love to have you join us. We have a lot of goals we've been talking about, and most of it revolves around our ability to not work as much and do this more. We have so many ideas and so many plans and so much shit we want to do, and we can't do any of it because we got to work too much to make money. So thank you for those of us who already are patrons. If you're thinking about it, even $1 a month, that's $12 a year. That would be huge. Every new person that comes in helps us build that up a little bit more. So we're not going to promise you prayers or healing or anything like. In fact, we're not going to give you much in return at all. But you're going to feel really good about it. So those are our patrons for this week. We will see you back here next week when Amy with an I will be reading them, and they'll probably be more boring. Bye.
Thanks thanks to all of you motherfuckers who put up with the Amy's droning on week after week. If you enjoy their delightful bitchcraft, please follow them on all of the social medias and send them all of your money on Patreon or PayPal. You can find them on these platforms by using the Google machine. It's not hard. If you want to bitch with other fans about the show, join the Secret Soup Talk Facebook group. If you want to tell Amy and Amy to fuck off personally, you can send an email to secularsouppodcast@gmail.com, although it may go unanswered. Please rate and review the show on iTunes, Facebook, and wherever else you can review things like this. It will help spread the soup gospel far and wide. And hey, text someone right now. Tell your friends. As always, we'll leave you with the vocal stylings of Mr. Eli Bosnick.
Secular soup creed. Soup is the ultimate virtue. It's delicious, nutritious, patriarchy smashing, racism fighting, warm and fuzzy, human affirming, fun having, anti-theist, glitter throwing, tummy satisfying, pair of new shoes fulfilling, diversity seeking, happiness. Minestrone, beef and barley, chicken broth and split pea, gazpacho, tomato, clam chowder and potato, chicken noodle, beef noodle, egg drop and ramen cup, miso, gumbo, leek and pho. Grab a bowl and taste the magic. Slurp even this.
Okay, so we've all got Audacity going?
Correct.
You bet. Yeah.
Okay, so here's what we're going to do. I'm going to count backwards again from 5, and when we get to the 0, clap as loud as you can into the microphone. Got it? So not on the 1, on the 0.
But you don't say the 0.
But I'm not going to say the 0. It'll be an implied 0, and that is where you clap as loudly as you can into the microphone. Okay, I think we got it. We can do this. 5, 4, 3, 2, 1. Damn it. You two were like half a second after I was, but it'll be fine. It'll be fine. Men are slower. I get it.